Now let's look at our thoughts. Our thoughts have a huge effect on how we feel, and the way that we're feeling has a big impact on the types of thoughts that we have. And there's a close relationship between negative thoughts and depression. Automatic negative thoughts that pop into our heads automatically, are a hallmark of depression. They can lead us into depression, and when we're already depressed, we can experience a constant barrage of automatic negative thoughts that leave us even more depressed. And as long as this vicious cycle continues, it can be extremely difficult to start feeling better. The basic premise of cognitive therapy, which is considered one of the most effective treatments for depression, is that when we change the way we think, we change the way we feel. And the technique we use to change the way we think is called cognitive restructuring, which is a way of helping us reframe our thoughts to make them less negative. Our negative thoughts do tend to have some truth to them, but they also tend to be heavily biased towards pessimism, self-criticism, guilt, regrets, helplessness, hopelessness, and negativity in general. The key to cognitive restructuring is to challenge the accuracy of our negative thoughts and then modify these thoughts so they present a more balanced perspective. We're not trying to replace negative thoughts with positive thinking that's equally biased in the opposite direction. We're simply trying to look at the bigger picture and see that there are other ways of looking at things that aren't so negatively biased. And once we're able to do this and our thoughts become less negative, our moods will start to improve. And once our moods start to improve, our thoughts naturally start to become less negative, which has a further positive effect on how we feel. And so we end up reversing this vicious cycle between our thoughts and the way that we're feeling, and we start a virtuous cycle that moves us in a positive direction.